Hello beautiful, thank you so much for being here. If you are new, welcome. I'm Cody, the founder of Montarbo Skincare, always here to help you have the most healthy, glowing, and gorgeous skin, regardless of your age, concern, or budget. And in today's video, I want to talk to you about why maybe your brightener or bleaching agent or skin lightener is not working, or you're not getting the best results and you think that you should. So this is very common, and so let's first talk about why the product may not be working on you. It could be that it is not penetrating deep enough into the skin where the real damage is, including into the dermal layer or the papillary dermis. So sometimes pigmentation is very deep in the skin and it's scattered throughout those skin layers. So the damage that you see on the surface it's like a mirage. The damage is always deeper than that. It appears on the surface, but it's deep. So you need to remember that maybe you use your brightener now and it works and you're like, oh my god, it's great, and then either it comes right back or you're noticing a deeper level of damage is what's happening. So because that pigment is deep in the skin, because it's accumulated that pigmentation over a long period of time, years, decades, and now you're just seeing it. So you bleach a little bit of it and then you think, oh, it's not working. Well, it's not that it's not working, it's just not getting in deep enough or getting to those deeper layers of where it actually needs to be in the skin. It could be that that's the wrong agent or brightening agent for your skin, including some people are sensitive to hydroquinone, and overly using hydroquinone could be bad for your skin because not only can you become sensitive, but it can start to change the type of pigmentation, causing like a haloing effect of the skin and causing a new form of pigmentation through the inflammation that's occurring. So you're getting inflammation because pigmentation is usually an inflammatory response through UV damage or through hormones or something that's going on. So you're having inflammation on inflammation through the use of that agent. So hydroquinone could be just not the right agent for you. You could do better maybe with salicylic acid or azelaic acid or licorice or alpha-arbutin or something like that. The other thing is that it could be that you're not getting that product deep enough into the skin layers, and a little trick and way around this is to either use your retin-A or your retinol together by either mixing the brightener that you currently have now with your retinol or your retin-A and trying that, cocktailing them together and then putting it on. Or you want to put on your brightener and put it all over to your skin, and then put on, once that absorbs a couple minutes, then put on a lot of your retinol or your retin-A. Doing that will push the brightener deeper into the skin, and it will start to even out the pigmentation through the skin layers, and it will allow the brightener not to just bleach the skin. You don't want to just bleach, you want to brighten, suppress, and allow for the melanosomes to evenly distribute through your skin layers, so they're not just piled up in one area. And using retinol or vitamin A in whatever form you can use now or have now will help that, so that it is not only suppressing the pigment, it's pushing it deeper into the skin, it's getting into the deeper levels of damage, and it's allowing that pigment or that brightener, whatever the agents are in that brightener, to be more pushed and scattered throughout the cells so that they are evenly distributed, because that's really important, is that you're getting an even distribution of those melanosomes spread through the layers that are being brightened, so that it's not just like one area you're bleaching or brightening. Because that's what happens, is a lot of times people use their brightener, whatever it is now, and it works, and then the pigment comes right back and they get frustrated because they're like, why is my pigment coming right back? I'm using this brightener. Well, you need to help it out a little bit with some with a retinoid a little bit, and that should really help. If you have any questions about today's video, feel free to ask them below, and always be safe and ask your provider, because if you're working with somebody professionally, they may say, no, don't do that, do this, don't do this, whatever it is. But I'll leave you with this also. These people that are using these high amounts of hydroquinone, I say just be cautious, because especially if you're not using the hydroquinone with retinoic acid or retin-A or a retinol, because it's just going to come right back. It's just going to bleach you and then it comes right back. That's how the pigmentation works. If it didn't get into the deeper layers of the skin and spread throughout and pushed throughout the whole scaffolding of the skin in the basal layer, then you're just going to keep getting that pigmentation popping back up as soon as you get UV damage or UV exposure. Anyway, love you guys. I'll see you soon in a new video. Remember to stay gorgeous. Bye.